let's focus on something I learned recently about your business is that, a very strong area of treatment for you is active people who play sports or have active lifestyles and need certain treatments that can help them depending on their ailments, right? And I wanted to hear more about this. I can rattle off a couple, but I can sort of let you take the stage. I know there's golf, sort of injuries or performance helping treatments for golf and tennis. Pickleball, right? Lots of older people now are playing pickleball. There's all kinds of injuries happening and treatments that they need. Can you talk about that?
Sure. I think the most important aspect of all that is prevention. But a lot of athletes, unfortunately, don't want to do prevention. And I see that all the time. When an athlete's proactive, not just with me, but with anything, in a preventative way, beyond stretching. That's why I think the stretching and the breathing really help a lot, especially for athletes. I mean, there's plenty of that on YouTube. And I think if you get an athlete earlier in the season, they definitely could still get injured. That's unavoidable for some people, depending on how hard they train and what they do from a preventative perspective. And when I say preventative perspective, I'm talking about a balanced body. The more balanced the body is, the better the athlete is. And that's why sometimes when you say athletes, it's hard to talk to an athlete that does not coming in for an injury. That's why a lot of times I like a lot of these younger parents to bring their younger kids in when they're starting out because it just helps. But Brian, the bottom line with all that kind of stuff is people don't want to keep their kids out when they're hurt. They just want to push them back in,
Oh, yeah.
and that makes it so difficult for me as a practitioner because, most people are getting them back in the game. I want to get them healthy before they get back in the game. And that's huge, because a lot of athletes, just like a lot of patients that don't want to come for this type of treatment and be proactive, it becomes tough, because I feel when you're young, you shouldn't push the body when it's injured. For what?
Hmm.
Give it a little time to heal, then you'll be good for a much longer period of time, But when you don't want to give the healing a chance, it becomes difficult. So with me, I'll do a lot more. Be honest with you, older athletes, like the older individuals who play golf, tennis, all that
Yeah.
kind of stuff, because they see quick results because they're in pain. You get them out of pain, and they understand. Just wait a week or two before you play. Sit on the side and have a drink while everybody else is playing. Something. And enough of them, do that. And then when you give them stretches and certain movements to do, whether it's a qigong movement, a stretch, a breathing exercise, they feel the difference when they start. So that really helps, And I always get the same thing, people they'll wait before they do it. I said, you do the breath? No. I said, well, just do it. I said, what's the big deal? You're there anyway. And then when they do it, they're like, wow, I didn't realize that it would make such a difference.
Well, I saw some friends recently this past week, and the topic of pickleball came up because my friends were a few years older than me. I'm in my mid 50s, but they were in their 60s, and they were talking about how they took up pickleball and they were all doing it and they were doing it like crazy and they loved it. And one of them said that they were seeing a high propensity of injury that these, we'll call them older. I mean, they're not young people, right? But they're not elderly, right? But older adults, and they were all in. They were loving it. They were in a great time. It's not the US Open or anything, right? It's not crazy, but they were a little competitive and they were seeing some injury. And apparently it was noted to me that this is common. Give me some practical, not just advice, but I guess examples of, how an avid golfer in their 50s or 60s can come to you and help prevent and help treat not catastrophic injury, but, oh, I'm a little sore after that. I played 18 holes. I normally play 9. Give me some insight into these different sports and how you might help.
When it's not just sports. People do gardening, all that kind of stuff. They all want to know why they're sore and they're tight. Well, most people didn't do anything all winter. And then they come out and they're going in their garden full throttle. And when they're doing it, they're not having any pain or discomfort. So they think nothing's wrong. Then the next day they're stiff, they're sore. So I give them a couple of little shaking things they could do, a little exercises, breathing exercises before and after, which really help tremendously with the overall tightness and everything, if you're not going to do anything. But I think most of it is just starting out too aggressive. in any sport, golf, pickleball, it doesn't matter what it is. And your body's not ready for it, like, especially say as we age, the athletes who are much older than me and you are still in great shape because they've been doing it all along. You get some of these guys and these girls in their 70s, and you would never know it, because they've been exercising and moving and grooving. So their bodies aren't being shocked by a little extra. And then I think one of the smartest things to become aware of, and I don't think we talk about it enough, especially as we age, doing too much. Doing too much sometimes has a detrimental effect as well. And I'm not saying just sit on the couch and be lazy, like anything else, right? The balance, knowing where and when is what would keep you the best. And I always get a kick because you see all these athletes, that are in great shape, but they're all banged up, all kinds of problems, knees, joints, neck, ankle. And most of it is because they just did too much. Not because they're not strong or they're not in shape and all that. It's because they just did too much. I think everybody has different set points. And I think we all have to become aware of it. If you want to stay healthy and continue, that's why it's always nice, right? Someone starts a sport in their younger years that they love, but it's not too much stress, swimming, right? Walking, badminton or something simple, where it's not overly stressed. And then you could still do it as we age. Because I think one of the toughest things for most athletes to do, and I see that with some of my friends and patients, is that when they're doing something for such a long period of time, for such intensity, and now they got to stop because of the pain and discomfort. So I feel it's two things. It's an emotional thing, because then that hits them. I can't do this anymore. I'm too old. All that negativity comes in.
Yeah.
Where it's not that you're too old. I don't identify the age. I tell people. I think it's a waste. I think that number kills us. One of these country songs, they say something about how old would you be if you didn't know when you were born? And it's like, makes sense. Like, if you think about it, like, if we didn't know these numbers and we just associate it to what we feel, sure, a group of people would stick together, and just complain about the same thing like they do now. And, not put an age on it. Just say, oh, my back hurts. My back hurts.
Yeah, it's
So
mindset. Yeah.
yeah, it's hard to take somebody who's got heart, wants to push and wants to have fun and wants to be competitive because they don't want to be told they can't do much or their body's hurting. So they push themselves, they'll take some drugs, medicine, whatever to numb the feeling, and they just push. And that you gotta factor that in too. And I think a lot with athletes, you have to factor it in. How hungry is he or she, or, that's why with the kids, it's a pain in the neck. It's not about the kids, it's about the parents. The parents are the ones that interfere with the kids' wealth and health and growing and stuff, because they want them to be something that's maybe realistic that they can't. And I think that's hard for a parent. I think your kid's a superstar and they're really not. So it depends, right? Where and when with the sports, where you're at in life, what you want, and then the bottom line, realistically, what can you do? You just test yourself. We should all test ourselves, I think, sometimes a little bit. If you can't touch your toes, maybe start just trying to touch your toes every day. And then when you get there, you say, okay, now we'll go to someplace else.
Yeah.
It's just, to me, it's a concrete way of saying it's got nothing to do with your age. This is where you're at this stage in life. To me, that's the most important thing.
I'd like to ask you, do you have some specific examples of treatments that you might provide specific active adults, that are doing, different sports like golf or tennis? Do you have some specific treatments that, you could explain?
I like to talk about these different things because we talk so much, or I talk so much about the mental aspect of it, because the physical part's to me so obvious. You come in, you're swollen, you're decreased range of motion, you got some pain and tenderness. So that's what I address, in combination with the talking to you a little bit. But when a person presents with, just say, I had someone come in, he was a golfer, hurt his elbow. It wasn't tennis elbow per se. And he couldn't move it, so, and it was painful a little bit. So I said to him, let me do a few things. And like acupressure, I did some working on his spine, a couple adjustments. And then I didn't need to go with him. I didn't need to go further. I didn't need to use infrared. That's another thing that I like a little more sometimes. When I do that on an area, there's no pain to the area. There's no pressure, nothing. Whereas the shockwave, that might hurt a little bit. And the rapid release might hurt a bit in the beginning. But with the infrared, it's like a precursor almost sometimes if I need to go, a little deeper. And when they come in and they have, say, decreased range of motion, they can't move their arm or their leg, whatever it is, they can't move it as much as they like to. I'll do a few things first and then retest and reevaluate. But if they don't have any improvement, then I'll try something a little different. And then at the end, if they have movement and less pain, I know how to proceed. So usually, say you came to me and says, oh, my knee's killing me. I said, okay, I palpate. When I say palpate, it's just touching the area to see what kind of response you get from the body, right? So I always start off with the spine because even I did the area of the body that's injured, I'm definitely going to get to that. But usually I'll start off with the spine, find some areas that are what we call subluxated, which means there's some nerve interference in that area and a little out of balance. So I'll address that and I'll go a little further and do a couple other questions and answers. And then usually get to the area where you have the pain. And then so I'll see if it's decreased range of motion, if it's swollen. And then you got to rule out fracture sometimes too, because I had people come to me that were just in a lot of pain. And I said, I'm not going to touch it till you go for an x-ray to rule things out. And sometimes they come back and they'll have a stress fracture in that area.
Wow.
So, it was good to do that to avoid, further injury or making the injury worse. So depending on how the person presents, because we're talking injuries here, right? An injury is an injury. And if I think it's past me, touching them first without an x-ray, I won't do it. But if they still have full range of motion and some other indicators that I feel it's okay and they're comfortable with it and it's not excruciating pain and the mode of the injury, how they got hurt, that's huge too. If you fall, if you hit somebody, all these different things can cause different types of injuries. And some things could rule it out more than others, depending on the age and the health of the individual. You don't know if a stress fracture is there. You don't know if there's a hairline fracture or something, deeper from something simple, that might not affect someone else. So that's the first thing. And then it's very simple after that. It's just, the treatment, which is either acupressure, infrared, some stretching or something like that to see how they progress. And then how they progress, that's how we do the next visit. And in the meantime, I usually give them some supplements or herbs to help with the healing. They definitely help, especially in injuries. I find that people who don't take the herbs and the supplements, it takes a little bit longer. It's almost foolish not to. But some people don't want to, and I get that. And then I'll give them some home exercises to do. Usually some breathing, stretching, a qigong movement or something like that. Something that I feel specifically will help their injury. So
and that's easy to do. That it's easy for people to do at home, like some of those stretches.
Everything I do is easy. If it's not easy, I don't want to do it.
Wow.
Think about it. You're gonna give me like people got these fancy things. I don't want to do that. I'm not gonna do it. Even a meal. Like sometimes a person gave me a recipe the other day for something. I'm like, seriously? 2-hour preparation. I can forget about it. My kids and my wife will kill me. 2 hours, come back for dinner. You know what I mean? Not that there's nothing wrong with that. Like if that's your thing and it's fun, but to me, health should never be difficult. No, I don't care what anybody tells you. If it gets complicated, I say run from it. Unless you're guaranteed if you do this thing 1 time or 2 times, you're going to heal 100%. Somebody offers you that, run from them too. I don't think anybody could do that. But, if it's not simple, and I go over it with them, they leave, make sure they feel comfortable doing it. And they could always call me if they have questions.
If someone wants to connect with you, how do they do it? Where can they find out more about Dr. Vinny and New Jersey Total Health?
Well, my favorite way is a phone call, 973-227-2170. And then the website's what? NewJerseyTotalHealth.com. Either one. Yeah. It's all written out, lowercase New Jersey, not NJ.
And when are you available? When's the best time for people to try to make an appointment? What's your schedule like?
Well, usually I'm in Fairfield Tuesday, Wednesday, Friday, and Saturday, and Monday by appointment. Yeah, usually because my Mondays fluctuate. Everything's by appointment. If somebody walks in, I have time, I'll treat them, but mostly appointment just makes it easier. And then I'm in Ledgewood 1 day a week at the Deep Wellness Center on Route 46 on Thursdays, usually from 12 to 6 or something like that. It depends on the day. If it's not busy, I leave early. If it's busy, I'll stay later. But mostly 12 to 6 are my hours up there.
Well, thanks for talking to me. I always learn something every time we sit down to talk, and I'm looking forward to the fall. It's going to be a busy time, and you've got lots more topics to talk about, and I'm thrilled we could make time today.
I appreciate it. Thank you. As always, I enjoy it. I like sharing the information, and it's fun for me. So thank you for that. You make it easy.
Do me a favor, follow us and like us on social media, and visit our website, NewJerseyTotalHealth.com.